Welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I am Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. And we're going to use the next 30 minutes to explore the latest data from the Pregnancy Risk Assessment Monitoring System, or PRAMS. It's a population-based survey conducted by the Hawaii State Department of Health, Family Health Services Division, in collaboration with the Centers for Disease Control and Prevention. PRAMS began in 1987 and now collects data from 46 states, the District of Columbia, New York City, the Northern Mariana Islands, and Puerto Rico. This encompasses about 81% of all live births in the U.S. The survey collects data on maternal attitudes and experiences before, during, and shortly after pregnancy. The overall goal of PRAMS is to improve health by impacting maternal and child health programs, policies, and maternal behaviors. Data collection procedures and instruments are standardized to allow comparison between states as well as to the nation. Women with a recent birth are selected for participation in PRAMS using the birth certificate. The survey follows a stratified systematic sample design, so women from some groups are sampled at a higher rate to ensure adequate data collection in smaller populations. Initial contact comes via the mail, and multiple mailings will be attempted, but if there's no response, the woman will be contacted and interviewed over the telephone. In Hawaii, about 1,300 resident women who had a live birth complete the survey each year. The data is then weighted to represent all resident women with a recent birth in the state. Hawaii became an official PRAMS state in 2000, so we have data from 2000 to 2022, excluding 2017 and 18 when collection operations were interrupted, and results are available at the state and county level. The questionnaire itself is made up of a core set of questions asked of all participants, along with some validated state-added questions. In 2022, Phase 8 was used, and this was actually the same as 2021. So as a result, there were no new indicators created in the warehouse with this data load. However, a new phase was just used in 2023. So once we have 2 years of data for any new indicators, we'll be creating those and adding them to the warehouse. For more information about PRAMS in Hawaii, check out the PRAMS page on the Family Health Services Division website. For Hawaii-specific data, you can go to either of our websites, hhdw.org or hawaiihealthmatters.org. And today I'm going to demonstrate how to access and explore the data on both of these websites. HHDW has fairly extensive coverage of the PRAMS survey for Hawaii-level data. Currently, there are 34 indicators in Hawaii Health Matters and 163 in hhdw.org. I want to show you how to find the PRAMS indicators on both websites. And I will run through this on the slides and then in the demonstration too, just so you get to see it twice. There are two ways to find PRAMS indicators on Hawaii Health Matters. The first is to use the search bar in the upper right-hand corner. If you type in PRAMS, you'll get a subset of the PRAMS indicators, but if you type in Pregnancy Risk Assessment Monitoring System, you'll see all 34 indicators. And that also comes with related content from our resource library. The second way requires a little bit more effort, but it pays off in the end. If you choose Find Data from the menu options below the HHM banner, it will take you to a page where you can see an option for Community Dashboard. If you click on this, it will pull up a tool for searching the indicators on HHM. We're actually going to do an advanced search, but don't worry, it's not hard. So what you'll want to do is scroll down to the filter by sources, and in this box, begin typing Pregnancy Risk Assessment Monitoring System, and you'll see a drop-down menu with options including PRAMS. If you click search at this point, you'll get a display of all the PRAMS indicators by state and county. So it's a great way to see the data, compare counties, just get an idea of what's going on. However, if you are more interested in just seeing what is available, what the 34 indicators are, you can select the indicator location summary. And then here's what your results will look like with a search for that. So all the PRAMS indicators are listed in their given topic and subtopic with state and county data indicated. And then if you're interested in more detailed data, you can just click on the indicator. On HHDW, it's a little more straightforward to find PRAMS indicators. Simply hover over the Data Sources option in the top menu bar to open a drop-down menu. Then once here, choose PRAMS data, and you'll be taken to the landing page of PRAMS in hhdw.org. And we'll explore this page a bit more during the demonstration. Before we get to the demonstration, I just want to introduce you to some concepts that apply to hawaiihealthmatters.org. So that site uses data and icons that use colors and symbols to help users interpret the point estimate. So in general, red is bad, green is good, and blue is neutral. You'll see trend results, and solid trends mean that it's a statistically significant trend. Mostly white trends are not statistically significant, but still exist. And checks and X's are used to denote whether a target is met or not. Okay, let's go ahead and get started with the demonstration. To get to Hawaii Health Matters, you can either type Hawaii Health Matters into your URL, or you can go to hhdw.org and get there from this green button here on the left-hand side. Now I'll show you what the two different ways. So up here, we can type in pregnancy risk assessment monitoring system, and that will give us all of the indicators that are available on the website. And then in addition, it also gives reports and fact sheets. So it gives some additional information that can be helpful in interpreting the data that you're seeing. The other way to do it was to go to Find Data and go to Community Dashboard, Advanced Search, and then simply type in pregnancy risk assessment monitoring here, and you'll see it comes up very quickly. So this is filtering on a data source on pregnancy risk assessment monitoring system. And if we hit search, it will show us all of the indicators with the data by state and county. So again, this is a great way to see the data, get an idea of what's going on. If you're interested in just what's available, then you can click on the indicator location summary, and this will give you the list of all of the indicators that are available. So you can see we have family planning, we have maternal, fetal, and infant health, we have mental health and mental disorders, and oral health indicators, all included from the PRAMS. So let's take a closer look at one of these indicators. We'll look at women who took folic acid or vitamins prior to pregnancy. And the first thing you're going to get is a geography selection. I'm going to pick state just so we can get a nice overview. So here what you see is a geography selection option, a measurement period option. So the default will be the most recent year of data, but if you were interested in looking at older data, you could. And then the definition, which is important because it tells you exactly what is being measured. So this indicator shows the percentage of women with a recent birth who report having taken a multivitamin, a prenatal vitamin, or folic acid vitamin at least 4 to 6 times per week in the month before conception. So it's a specific definition, and it's good to know what exactly you're seeing. Below the definition is a little bit of why it's important, why we're measuring it, and then we get into the data itself. So we can see here that our source is the Pregnancy Risk Assessment Monitoring System. And in 2022, 49.9% of women took folic acid or vitamins prior to pregnancy. I will also note that here, if you click on this link here, it will take you to this exact indicator in HHDW. So if you're interested in manipulating the data further, that's a quick and easy way to get to HHDW. So what Hawaii Health Matters does is it offers you some comparison values to give you an idea of what 49.9% really means. So we can see that we're higher than the US value, which was 46% in 2021. We're about equal to our prior value, which was 45.1, no statistical difference. But we are trending up, and it is a statistically significant trend. You can see as I'm hovering over these icons, we get these pop-up windows that give you additional information. That's great to help understanding what you're looking at and interpreting the estimates. There's also a legend over on the left side, and it's always available. So if you're looking at something and you can't remember what it means, just check the legend. All right, once we go below the comparison data, we start to see the trend data. And here you can hover over the graph to get the actual data values. You can also export this graph, download it as a JPEG or a PDF, or you can download the underlying CSV data and do your own visualizations. And then there's also a couple of chart options like showing the confidence intervals. So here we can see that it definitely looks like it's trending up, which is great. Below the trend data is where we'll see the data broken out by different subgroups. So for PRAMS, we can look at the indicator by age to start with. You'll see here that older women, they're more likely to have taken a vitamin or folic acid prior to pregnancy. And the system is actually running some statistics behind the scenes. So when you see a green bar, it means that it's significantly better than the overall value. And if you see a red bar, it means it's significantly worse. So here we can see the women who took folic acid or vitamins prior to pregnancy by age, by birth weight, by gestation, by percent of federal poverty level, by race, ethnicity, and also by WIC benefit. So this is a great way to identify also populations that might be at risk or where there may be a health disparity. Below the breakout data is an option for, again, to see different geographies. And I do want to show you what the county data looks like. So if we click on counties, and here we go, and what this does is then it ranks the 4 major counties in order of prevalence. So we can see that Honolulu actually has the highest percentage of women who took folic acid or vitamins prior to pregnancy. And then you can also use these comparison values, so you can compare to the state value, you can compare to the US value, you can also compare to prior values, or look at the trend over time. So this is a great way to explore the data. You'll notice that when I hover over one part of the graph, it lights up in the map and actually in the data table as well. So this is just a helpful functionality of the system. It's especially good when you're looking at a lot of different small geographies. Below the data, now we see the related content for this indicator. So again, we're seeing resources that have been pulled from our library. So indicators, reports, data resources, fact sheets, websites, plans, etc. All of these things that are related in some way to women who took folic acid or vitamins prior to pregnancy. So this is a great place to see what is available. So that is Hawaii Health Matters. So as we showed from HHDW.org, it's a little bit simpler to get to PRAMS data. You can just go to the data sources and click on the PRAMS data. Here we have the landing page for the PRAMS data. So it gives a little information about the survey. And then down here, it shows you how many women were surveyed. It gives you links to the surveys itself and data release notes. So every year, we always make sure that we note any differences that are new with that data release. Below all of this, we have some trend reports and some fact sheets. Some of these have been recently updated, so this is always a good place to check for resources in addition to the data. But if we want to actually see the data and create a report, we're going to go to Build a Custom PRAMS Report. And here we now have our health indicator selection page. So this is where we can see all of the different indicators that are available for analysis. And you can see we have them divided up into groups: before, during, and after pregnancy, and infant measurements. And then as you click into each category, there are subcategories. So for instance, before pregnancy, we might be interested in alcohol, tobacco, or drug use. And I am going to look at marijuana use before pregnancy as an example, because I know it's an interesting topic. So I've clicked on marijuana use before pregnancy. And now what we see is this default query result page. So this box here tells you exactly what you're looking at, which is great. So it's women who use marijuana or hash in any form during the 12 months before they got pregnant. And in the default report, what you'll get is the 3 most recent years of data. So in this case, it's 2020, 2021, and 2022. And now you can see the data. And again, you can hover over the graph to get the actual data values, or you can scroll down to the data table. And this table can be exported to Excel as well. If you're interested in the technical notes, which are a good thing to keep an eye on, that is below the data. So here we have the question wording and a little information about weighting. There's the suggested citation and some statistical stability and survey information. So always a good idea to keep an eye on that. So this is what our default report looks like. But let's say that we were interested in looking at the data in a different way. We can hit this Modify Query button. And now we see our query builder page. So here we have a lot of different options for filters. So if you were interested only in a particular age group, you could select that age group here. If you were interested in only a particular race, ethnicity, you could select that here. We also have marital status, education, poverty level, gestation, birth weight, and WIC. And then this step is where you tell the system how you want to see the data. So I'm not going to filter it. I want to see the data by mother's age group, but I want to see all of the age groups. So I'm going to go ahead and submit. And now what we can see is a marijuana use before pregnancy by mother's age. So as we can see that it's a little more common among younger mothers, although not statistically significantly different. Again, the data table is here available for export. So this is great, and you can look at the system in many different ways. So say we were interested in mother's age group, and you can also look at the system by 2 different categories at the same time. So for example, say we wanted to see what marital status does. Now we're looking at the data both by mother's age group and by marital status. And you'll notice here we do have one number that's suppressed. that means that the relative standard error was greater than 30, or there were less than 30 people that responded to that survey. So it's not a stable estimate. And again, be sure to remember, I didn't change the year, so we're still looking at 3 years of data aggregated together. And we can see here that, yes, it appears that marital status does tend to decrease the prevalence of marijuana use before pregnancy. And then again, we've got the data table here with everything that we need to know, additional information about the stability of the estimates, and all of our technical notes. So this is a great system to use. We've got it's got a lot of power, and you can see all of the different indicators that are available. There's a lot of different information here. So it's good just to kind of get in there and see what's available. I'm going to continue and let you get your hands in the system a little bit. So here are 4 questions that you can take a few minutes and explore HHM and HHDW and answer these questions, where you can find those. So the first one is, what percentage of mothers received early and adequate prenatal care? And this is for Hawaii Health Matters. So what I would do is I would use the search box and do prenatal care, and then look and see what the options are. So it's the first one is mothers who received early or adequate prenatal care, and that's what we're interested in. So if we select that, we're looking at the state value. We can see that 63.2% of women received early and adequate prenatal care in the state. The second question is, which county has the highest percentage of women with a healthy body weight prior to pregnancy? So again, I'm just going to use the search function and see if I can pull up the indicator that we're looking for, which is right here, women who had a healthy body weight prior to pregnancy. Now, in this case, we're interested in the county level data, so I'm going to choose county. And the question is, which county had the highest percentage of women with a healthy body weight prior to pregnancy? So we can see here, the answer is Hawaii with 52.3%. The other 2 questions were from HHDW, so let me show you how we can find those. The first one was, what DOH race ethnicity had the highest rate of babies born with low birth weight? So we're interested in looking at birth weight, which happens to be a characteristic of the infant and the delivery. So here we have birth weight by category, or birth weight, choose a particular response. I'm going to go ahead and do the choose a response option because I happen to know that the default option for this is low birth weight. So here we have the data by year, but we're interested in the data by race ethnicity. We come here and tell it that we want to see the data by race ethnicity. And here we go. And you can see that Filipina moms seem to have the highest rate of low birth weight babies, according to this data. And then the last question was, from 2020 to 2022, which county had the highest rate of mothers reporting depression during pregnancy? So we can go to select a new indicator. That'll take us back to our indicator selection page. And this was asking about depression during pregnancy. So we're going to want to go to during pregnancy and mother's health. And it's asking about county. So we'll take a look at the county level data. And here we can see that Maui County had the highest rate of mothers reporting depression during pregnancy with 12%. So those are the answers to our activity, and I'll post the answers again here. So we look forward to seeing you in July when we'll be exploring ITOPS and fetal death data. Mahalo and enjoy the rest of your day.